As a business person, I go where the money is. The budget problems that we're facing are not coincidental. We haven't had a business person running government since Dick Snelling. A business person goes to where the problems are. Where are the problems? Montpelier's problems and your problems happen to be the same. The first is healthcare. Biggest area of growth in state budget, biggest area of growth in Vermont families and small businesses budgets. Second area is corrections. Let's talk healthcare. I support, and will do everything in my power to pass, a single-payer healthcare plan that gets health insurance off the backs of our employers and off our property tax base. Why do we have to do this? It's simple math. Over the last 8 years, we have seen in Vermont, this little state of 660,000 people, our healthcare costs rise by $2.5 billion. $2.5 billion. It's $1 million a day more tomorrow than we'll spend today on healthcare. This is not sustainable. So I propose, working with Washington, to get the waivers. I ask you this, how many people in this room think that Washington has saved us from ourselves on healthcare? Raise your hands. Yeah. That's Brian's plan, to implement that bill. I say that bill is going to make matters worse, not better. This is what I want to do. I want to get waivers from all of that. I want Vermont to treat their health insurance like General Motors, Ford, Oracle, and Microsoft. One family, one plan, get rid of the administrative waste. We spend 12 to 14 cents chasing money around in this crazy system. Have a medical card for every Vermonter so that we get efficiencies. We know what tests have been completed, what tests haven't. 30% of all medical tests in Vermont are duplicative because the next provider doesn't know what the last one did. And finally, the first system in the country. When you come out of the provider's office, you adjudicate the bill on the spot, just like in your grocery store. You don't leave without having paid your share of the bill. That's what we can do. We have a very brilliant person named Dr. William Shaw from Harvard, who for the first time is going to give Vermont a blueprint for how we could actually do this system. And what I'm saying is, we've got to do it. We have to provide quality health insurance to all Vermonters where it is a right and not a privilege, contain costs, and have it follow the individual instead of being an obligation of the employer. If we don't tackle this one, if we're spending $2.5 billion more in 8 years, I believe we'll bankrupt our small businesses, bankrupt our taxpayers. We have a huge challenge here. Let's let Vermont lead the country on this one. I have the vision and the ability to get tough things done. If you hire me, I'll try my best to work with you to develop and implement this system. Brian's plan of relying on the federal bill and sitting back and hoping that we can somehow magically solve this problem is not a plan. I have a plan. I'd ask you to join me in helping me execute it. We'll work collaboratively to get it done.
Thank you.